Today, Cambridge-based Moderna reporting its COVID-19 vaccine is nearly 95% effective. Here to discuss it with us is Dr. Brian Hollenbeck, Chief of Infectious Disease at New England Baptist Hospital. Good to see you.
Good to see you too.
All right, so this number even better than what Pfizer reported last week. They said 90% effective for their vaccine. Can you tell us the difference between these two vaccines and how soon you think they could actually be delivered to the public?
Yeah, they're both very similar vaccines in terms of how they work. They both train the body to make a small part of the coronavirus and then teach the immune system to clear that part of the coronavirus so that if you ever encounter the real virus, you can clear it out. They both show that they're pretty similar in terms of efficacy. 90 versus 94 is not a huge difference in this preliminary data. There's 95 people with coronavirus in the Moderna study out of 30,000,
right,
and I think 94 in the other out of 42,000. So pretty similar overall. There's a lot of logistical stuff to get these out there. There's millions of these vaccines, both of them, that are made. And once they go through the FDA process and they receive authorization, then they'll be available for certain people immediately, and for everybody else, hopefully by winter to early spring.
So it sounds really promising. We know this is early data. Do we know yet that if someone gets this, if they're vaccinated, is it possible they could still become infected, or that they could maybe pass on the infection if they come in contact with someone who's positive? Do we know that yet?
We have some information from that. The Moderna study, there was 95 people that ended up getting coronavirus. 90 of those were in the placebo group. Those are people that didn't actually get the vaccine, they got the placebo. And 5 of those people did get the Moderna vaccine, but still got the virus. So we don't yet know, are those people that were kind of early on before immunity had fully developed, or was it not fully efficacious? Either way, 95% is a great number.
Okay.
Better than most people expected.
I want to talk big picture here just before we let you go. Cases surging everywhere right now. Some interesting stats. If you take a look at this, a sampling of how many days it took the U.S. to reach an additional 1 million cases of COVID-19. So 3 months for the first 1 million, 6 days to add the last 1 million. What does that tell you as far as the status of virus and how people are handling this?
It tells us that there's a lot of people right now that have coronavirus. And so we know that every 10 people that have coronavirus right now, depending on the part of the country, will pass it on to 12 to 14 additional people. So if you look at 1 million people, then you're going to have somewhere in 1.2 to 1.4 million people that are getting coronavirus from that next cycle. So there's just a lot of people with the virus right now, is what that shows.
Yeah, and hopefully promise with these vaccines, right? I mean, we keep our fingers crossed, wait for the data. All right, Dr. Hollenbeck, thank you so much for your time. We appreciate it.
Thank you.